I am Dr. Mohan, passed out MBBS from Stanley Medical College in 1979 and practicing for the past 42 years in field of general medicine and diabetology. And this, of course, we assembled here to discuss about the high blood pressure that is called hypertension and the ways of preventing this hypertension. High blood pressure is a pressure which is above 130/90. Every person has got blood pressure. Blood pressure is essential to maintain the blood sugar to the whole of the body. But if it is at a ratio level above more than 129, systolic and diastolic 89, that is called hypertension. Hypertension is the most common condition existing in the whole of the society, and it is very easily neglected by the patient because it doesn't give problem always. It doesn't cause symptoms like fever immediately. The symptoms of hypertension is dizziness, headache, disturbed sleep, unsteadiness, and vomiting. Those things which are very easily neglected for other reasons. So the causes of hypertension, first age. See, when we are young, the blood vessels are very thin and had good elasticity and no deposits of cholesterol in the blood flow. So the heart easily pumps the blood into the water. When water is it goes out to the whole of the body. As age goes on, because of our dietary habits and other things, cholesterol and fat deposited in the blood vessel, in addition which is sustained for the heart to pump blood into that. It's called peripheral resistance. One thing. Our habits, our personal habits give a lot of concern in this blood pressure. And obesity, lethargic life, and habits like smoking, alcohol, those things are very causative factors. And more of the salt intake in the food, those things are common reasons for blood pressure. And this is the most easily diagnosable disease. Just checking the patient blood pressure with a sphygmomanometer is the only test required to detect high blood pressure. So after having detected, we come to the treatment section. See, there are many factors in treatment of hypertension. First thing, our personal habits. We will have to do daily walking and aerobic exercise every day. Walking improves the strength of the heart. Aerobic exercise increases the heart strength so that the pumping is very easy. And next thing, personal habits like smoking and alcohol should be totally stopped. And smoking is very injurious to the health. Next thing, and diets. We should not take more saturated fats and no pre-cooked foods. No fast food like this. We will have to restrict the salt and stop adding extra salt to the food. Whatever the salt remains during the entire cooking, that is sufficient. The salt intake should not exceed more than 4 grams a day. 1 teaspoon of sugar, salt is equal to around 2.5 milligrams of salt. So based on the calculation, we can restrict our diet intake. And stress-free life. And we will have to take good rest, relax ourselves by listening to the music and consulting with others, talking with others and relatives so that you let out your tension. First thing. And medicine. See, you have to definitely go to your doctor as age advances above 30. You have to definitely get checked up your BP. The BP monitors are easily available in the market now. Everybody can do self-test. Anything beyond BP above systolic 129 and diastolic above 18 has to be immediately taken care of. And take regular medicine, whatever the doctor prescribes. And not only that, this not stop alone. You will have to keep on reviewing with the doctor and check your BP and keep the BP under control. And do walk every day after 1 hour. And do certain exercise. Take good amount of sleep. Avoid unnecessary medications. 5 years of untreated hypertension will lead to diabetes. And 5 years of uncontrolled hypertension can cause your damage, kidney damage, and sometimes the patient may go in for renal failure. So these are the main reasons. Remember, hypertension is the most worst culprit which causes heart attack, which causes kidney disease, which causes kidney failure, and which causes stroke by way of defects in the blood, the deposits and getting separate, blocking the blood vessels. So having this in mind, please kindly take this take your attention on the diet of food. or take plenty of fruits and vegetables, potassium-rich diet as fruits, and avoid fast food, avoid pre-cooked food, restrict the salt as much as possible, restrict the alcohol. More than 30 ml per day is not advisable, and better even if you stop it totally, and restrict your salt and this is salt intake, and stop smoking cigarettes. Thank you.